You've seen the ads, big bold letters, $0 premium. It sounds like a gift, right? No monthly bills, all the perks. But at the Senior Savings Network, we hear the same question every day. Is it actually free? The short answer, no. Today we're looking past the $0 labels to show you where the real costs are hiding. If you're looking at Medicare Advantage, you need to see this before you sign on the dotted line. Here's the first and most expensive thing people misunderstand about Medicare Advantage. When you hear $0 premium, that does not mean zero cost healthcare. It simply means there's no monthly fee to enroll in the plan. That's it. That's the headline, not the full story. Think of it like a gym membership with no monthly dues. Sounds amazing, right? But then you find out it's $20 every time you try to use the treadmill, $40 for the weights, $75 if you want a trainer. The gym is free until you actually try to work out. That's how Medicare Advantage works. With these plans, you pay as you go. You pay a copay to see your primary doctor, a higher copay to see a specialist, daily copays for hospital stays, separate cost for outpatient surgery, imaging, and emergency care. And here's the key point most commercials leave out. The more healthcare you need, the more money you pay. If you're healthy and rarely see the doctor, the cost may stay low. But if you develop a chronic condition or have a hospital stay, those small copays can add up very quickly, sometimes into the thousands. This is the part almost no one explains clearly, and it's where most people get blindsided. It's called cost sharing. When a plan has a $0 monthly premium, the insurance company still has to get paid somehow. They don't eliminate cost, they shift them. And they do that through three main buckets. First, copays. These are flat fees you pay every time you use care. $10 to see your primary doctor, $50 to see a specialist, $90 or more for an emergency room visit. Individually, these don't sound terrible, but healthcare isn't a one-time event. It's repeated visits, follow-up tests, and referrals. These small fees stack up fast. Next, and this is where things can get very expensive, is coinsurance. Instead of a flat dollar amount, you pay a percentage of the bill, commonly 20%. That means 20% of outpatient surgery, 20% of advanced imaging, 20% of specialty treatments like chemotherapy. So if a treatment costs $10,000, you're responsible for $2,000, and that's not theoretical. These are real numbers people see every year. And finally, deductibles. Many Medicare Advantage plans, especially for prescriptions, require you to pay a certain amount out of pocket first before the plan contributes anything at all. Until you hit that deductible, every dollar comes from you. So when you put it all together, copays, coinsurance, and deductibles, you start to see the real trade-off. A $0 premium plan can look inexpensive on the surface, but the costs show up only when you actually need care. And the surprise isn't the price, it's when and how fast it adds up. Now let's talk about something that matters just as much as the cost, but gets talked about far less: the provider network. With original Medicare, you can see any doctor or hospital in the United States that accepts Medicare. No referrals, no network approvals. If they take Medicare, you're in. But Medicare Advantage is different. These plans are run by private insurance companies, and they come with specific networks, pre-approved list of doctors, specialists, hospitals, and facilities that you're allowed to use. If your doctor is in a network, you pay the plan's copay or coinsurance. If your doctor's out of network, that's where people get into trouble. In many Medicare Advantage plans, out-of-network care isn't covered at all, or it's covered at a much higher cost. That means you could be responsible for 100% of the bill. And here's the part that really catches people off guard. You might join a plan because your doctor is in network today, but networks can change every single year. Doctors leave, hospitals drop contracts, insurance companies renegotiate, and suddenly the specialist that you've trusted for years is no longer covered. At the Senior Savings Network, we see this all the time. People come to us shocked, sometimes angry, because they're being told to switch doctors, change hospitals, or drive farther for care, all to keep their so-called free plan. For someone managing a chronic condition, seeing a specialist regularly, or undergoing treatment, that disruption can be more than an inconvenience. It can be overwhelming. So when evaluating a Medicare Advantage plan, the question isn't just, is my doctor in network? It's, am I okay being limited to a network that I don't control? Because with Medicare Advantage, your plan chooses your doctors, not you. There's another cost most people never think about when they choose a plan, and it's not measured in dollars. It's measured in time, stress, and delays, and it's called prior authorization. Most Medicare Advantage plans require prior authorization for certain services. That means before you get care, your doctor has to ask your insurance company for permission. This can apply to MRIs and CT scans, outpatient surgeries, skilled nursing or rehab stays, home health care, and even some prescription medications. Until the insurance company says yes, the care simply doesn't happen. And here's what so many people don't realize. That decision isn't made by your doctor. It's made by your insurance company, often using internal guidelines and reviewers who have never met you. Sometimes approvals are quick. Other times they can take days or weeks or even months. Now imagine you're dealing with a possible cancer diagnosis, worsening pain, loss of mobility, or a sudden change in your health. Waiting isn't just an inconvenience, it's emotionally exhausting. And if a request is denied, your doctor has to appeal. More paperwork, more waiting, more stress. Original Medicare rarely uses prior authorizations, but with Medicare Advantage, it's built into the system. That's how costs are controlled, not by charging you more upfront, but by controlling when and how care is delivered. So when you're choosing a plan, the question isn't just, what does this cost? It's also, am I okay asking for permission for my care? Because when you're facing a serious health issue, the last thing you want is a stop sign between you and your doctor's recommendation. Now let's talk about the biggest surprise of all, the one that no commercial states clearly. Even if you enroll in a $0 Medicare Advantage plan, you still have to pay your Medicare Part B premium. That bill doesn't disappear, it doesn't get waived, and it doesn't get replaced by the Medicare Advantage plan. Medicare Part B is what covers things like doctor's visits, outpatient care, preventive services, diagnostic tests, and Part B is required, whether you choose Original Medicare or Medicare Advantage. That monthly premium, often $202.90 or more, depending on your income, comes straight out of your Social Security check every month. Here's where people get tripped up. They hear $0 premium and assume they're avoiding a monthly healthcare bill. But in reality, they're still paying Part B, plus copays, plus coinsurance, deductibles, and other out-of-pocket costs when care is used. So the Advantage plan didn't replace the bill, it just added another layer on top of it. And this matters because when you compare plans, you have to compare total cost, not marketing language. No matter what plan you choose, Original Medicare, Medicare Advantage, supplement plans, Part B is non-negotiable. So the real question isn't, can I avoid paying Part B? It's what am I getting in exchange for that Part B premium? Because a $0 Medicare Advantage plan isn't free. It's just no cost to join. And understanding that difference can save you from a very expensive misunderstanding. So after all this, the big question is, do $0 Medicare Advantage plans ever make sense? Yes, absolutely they can. But only when the copays, the provider network, and the drug coverage truly match your healthcare needs. Not just today, but realistically over the next few years. The mistake is choosing a plan just because it's free. Because free only describes one small part of the plan, the monthly premium. It tells you nothing about what you'll pay when you're sick, which doctors you can see, how fast you can get care, or how much risk you're taking on in a bad health year. At the Senior Savings Network, we encourage our clients to ignore marketing language and focus on the number that actually matters, the out-of-pocket maximum. That's the cap on how much you could be responsible for in a single year if something serious happens. Because even with a $0 premium plan, the maximum could be several $1,000s. And if you're not prepared for that number, financially or emotionally, it can be a very unpleasant surprise. So the right way to choose a plan isn't what's the cheapest option today. It's what's the plan I can live with in my worst case year. When you choose based on total cost, access to care, and long-term fit, not hype, you end up with coverage that actually works when you need it most. That's the goal. Medicare can be confusing, and honestly, it's not designed to be easy. Between the rules, the fine print, and the marketing, it's a lot for anyone to sort through on their own, and you shouldn't have to. If you'd like a real personalized look at what a plan could actually cost you, based on your doctor's prescriptions and your healthcare needs. We're here to help. No pressure, just clear answers so you can make a confident decision. You can give us a call or visit our website anytime to learn more. Thank you for taking the time to watch. We appreciate the trust you place in us, and we look forward to helping you protect your healthcare and your peace of mind.